One moment, ladies and gentlemen. Thank you. Okay. Thank you, counsel. Mr. Walgren, you may call your next witness.
The people would call Dr. Rogers to the stand.
Sir, please stand in the witness box. Please raise your right hand. Do you solemnly state that the testimony you may give in the cause now pending before this court shall be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
You may be seated. Please state your name for the record. Spell your first and last names.
Christopher Rogers, Christopher Rogers.
Dr. Rogers, good morning.
Good morning.
Let me provide you with some instructions that I give to every witness in every case. The first, please sit back and relax. The second, please speak loudly. Everybody's got to be able to hear you, so it would help if you spoke in a little louder voice. Thirdly, if you are called upon to provide a yes or no answer to a question, use those terms yes or no and avoid slang which can be a little tricky. And lastly, please wait until you hear an entire question before you even start to answer it. Many of us think we know what an answer is, so we start to interrupt the questioner. But in court, it's important to hear the whole question first and then respond. Is that acceptable?
Yes, thank you.
Direct. Mr. Walgren?
Good morning, Doctor.
Good morning.
Sir, what do you do for a living?
I'm a deputy medical examiner for Los Angeles County.
And what is a deputy medical examiner?
I do autopsies in coroner's cases and determine cause and mode of death based on the findings.
And how long have you been a deputy medical examiner?
Since 1988.
And your current position is what?
Chief of Forensic Medicine.
And doctor, can you describe for us what is forensic medicine?
Forensic medicine is the part of pathology that deals with coroner's cases. So, in other words, dealing with sudden, violent, or unexplained death.
And prior to being employed at the LA County Coroner's Office as a deputy medical examiner, can you describe for us your educational background and training?
I attended medical school at the University of California, San Diego. I did pathology residency at Los Angeles County USC Medical Center. I trained in forensic pathology at Los Angeles County Coroner, and I'm board certified in forensic pathology.
Has your entire career been devoted to forensic pathology?
Yes.
And of course you are a medical doctor?
That's correct.
What is an autopsy, doctor?
An autopsy is an examination of the outside of a deceased person as well as each of the internal organs.
Describe for us in general terms then when you say the outside of a person, as a forensic medical examiner, what are you looking for in your conducting an autopsy on a given individual?
Well, I would be looking for any injuries that might be present or evidence of natural disease, or also any kind of identifying features like scars or tattoos.
And all of this is in pursuit of determining the cause and manner of death?
That's correct.
Now, you also mentioned, in addition to the outside of the body, you conduct forensic analysis of the internal organs. What are you looking for there, generally speaking?
In the internal organs, I would be looking for any abnormality or disease in the organs themselves, and then I would also collect specimens for supplemental testing, such as toxicology or criminalistic testing.
All right. And how many autopsies would you say you've personally handled or been present for in your career?
I would say several thousand.
And did you conduct the autopsy on the decedent, in this case, Michael Joseph Jackson?
Yes.
And does your autopsy report bear a particular case number that identifies it as being the report and findings related to the decedent, in this case, Mr. Jackson?
Yes, it does.
Okay, is that number 2009-04415?
Yes.
When did you conduct that autopsy, Dr. Rogers?
That was on June 26, 2009.
And going through the findings you made on June 26, 2009, let me ask you initially, on that day, June 26, were you able to definitively state a cause of death?
No.
And why not?
There wasn't anything obvious in the history or the autopsy examination that showed a cause of death.
Okay. Let me ask you about the general health of Mr. Jackson as related by you in your findings in the autopsy report. Generally speaking, how would you characterize the overall health of Mr. Jackson based on your autopsy findings?
I believe that he was healthier than the average person of his age.
And in your initial summary of findings, were there incidental findings that you made as to general conditions or health issues you identified regarding Mr. Jackson?
Yes.
And what were some of those findings, please?
He had an enlargement of the prostate gland, which meant that it was difficult to urinate, so he was retaining urine.
Okay.
He had vitiligo, which is a skin disorder. And then he also had...
Is that vitiligo, that's the depigmentation of the skin where, for example, an African American might have white splotches of skin?
Yes.
Okay.
And he had a polyp of his colon. And then we also sent portions of the autopsy to specialists in various areas. So the nervous system showed mild diffuse swelling. The lung examination showed some chronic inflammation and scarring in the lungs. The radiology examination showed an extra rib and also some arthritis. And then we did a dental examination which showed that there had been some root canal therapy and implant therapy. And we also did an anesthesiology consultation.
All right. And were there observations made as to a previous injury sustained in the scalp area?
Yes.
Dr. Rogers, you can help me out a little bit. For purposes of our internal sound system, we may not be picking up everything. So if you could speak a little bit louder, it'll help us out in court. Thank you.
And regarding the scalp, what was observed?
There was an area of irregular pigmentation at about the top of the scalp.
Were you aware that his scalp had caught on fire many years prior?
Yes.
And that was through filming of a commercial where there was an accident that took place?
Yes.
Now, when you conducted this autopsy, did you note the height and weight of Mr. Jackson?
Yes.
And how tall was he and how much did he weigh, please?
He was 5'9" and weighed 136 pounds.
And what is the body mass index?
That's a single number that you can calculate from height and weight to give you a general idea of whether the person is underweight, normal weight, or overweight.
And with Mr. Jackson's height, his weight being 136 pounds, where did he fall on the body mass index?
He was within the normal range.
He was, however, a very thin individual. Is that fair to say? Or a thin individual?
Yes, he was thinner than most, I believe.
But according to the body mass index, he fell within what would be described as normal.
That's correct.
And was a photograph or photographs taken documenting Mr. Jackson's general physical condition on that date, which also shows his general weight of his body, at least visually?
Yes.
And I have a photograph taken at the time of autopsy. Defense in the court has previously seen it. It has been blacked out in the genital area, Your Honor. May this be marked Peoples 206 for identification?
Yes.
Dr. Rogers, showing you what's been marked as Peoples 206 for identification, does this bear the coroner's case number 209-05?
Yes.
And this was taken on June 26, 2009?
Well, I'm having a little trouble reading the number. It may either be the 26th or the 25th.
Actually, what is that date reference?
Well, to me that looks like 6/25/2009.
Actually, looks like the wrong date is on there. Looks like 8/25/2009, doesn't it?
Well, it does look a little bit like an 8.
Was this a picture taken of Michael Jackson's, at the time of Michael Jackson's autopsy, bearing the number 2009-04415?
Yes.
And does this accurately depict his body and visually depict his weight on the date of June 26, 2009, when you conducted the autopsy?
Yes.
Now, in regard to your evaluation of the internal organs of Mr. Jackson, I'd like to ask you about his heart. Were you able to draw conclusions related to his heart, whether he had any heart disease and things of that nature?
He did not have heart disease.
Were there any abnormalities noted by you regarding his heart?
No.
Did you make any observations regarding his coronary arteries?
The coronary arteries did not show any atherosclerosis.
Was that unusual?
In this context, yes.
What do you mean by that in this context?
Well, he was 50 years old. At the age of 50, almost everybody has some atherosclerosis in their coronary arteries, but he didn't have any.
What is atherosclerosis?
That's a buildup of fat and cholesterol on the walls of the blood vessels.
Okay, and Mr. Jackson did not have any buildup of this fat or cholesterol on the walls. Is that accurate?
Yes, in the heart.
In the heart, and that was unusual based on his age.
Yes.
Was that a factor that led you to conclude that, generally speaking, he was a healthy individual for his age?
Yes.
Now, did you observe any trauma or any natural disease in conducting your autopsy that would have led you to conclude that that was a cause of death?
No.
Did you make observations regarding his esophagus?
Yes.
And was his esophagus intact throughout?
Yes, it was.
Did you see any white liquid substance in either his stomach, his throat, his esophagus, or his mouth?
No.
Could we have an explanation of what is an esophagus, please?
Dr. Rogers, what is an esophagus?
The esophagus is the tube that connects the mouth with the stomach, so when you swallow, that's what the food goes through.
From the mouth down to the stomach?
Yes.
And it was intact and that you did not observe any milky fluid in the esophagus?
That's correct.
Or in the stomach?
That's also correct.
Did you also, Doctor, examine the stomach in detail to determine if you could find any pill tablets or pill capsules of any kind in the stomach?
Yes, I did.
And what were your findings in regard to the contents of the stomach? Is it related to any pills or tablets of any nature?
The stomach contained 70 grams of dark fluid, but did not show pills or capsules.
And was that something specifically you were looking for in this case to determine if oral administration of pills or tablets could have been a potential for the cause of death?
Yes.
May I have just one moment, Your Honor?
Yes.
Now, did you also, Dr. Rogers, check the mouth and upper airway for any foreign material or things of that could have been in the mouth or oral airway?
Yes.
And when I say oral airway or upper airway, what does that mean?
It means the entrance to the breathing passages, so it would be through the mouth and down the throat into the windpipe.
All right. And the trachea, what is that?
That is also known as the windpipe.
All right. So did you check the mouth and upper airway and trachea for any type of foreign material?
Yes.
Did you find any?
No.
Now, in conducting your autopsy then on this initial date of June 26, 2009, you indicated you were not on that day able to determine the cause of death, correct?
That's correct.
Did you request subsequent toxicology testing to be done to assist you in determining the cause of death?
Yes.
And did you also seek out consultations with other experts in various fields, including an anesthesiologist, Dr. Collins?
Yes.
Did you also reference the transcript of Dr. Murray's interview that was played to the jury the last 2 days? Did you read through that interview transcript?
Yes, I did.
Did you also, as an opportunity to assist you in your investigation, seek out medical records from Dr. Murray regarding his treatment of Mr. Jackson on that day?
Yes.
Were you able to obtain any?
No.
At some point following your receipt of the toxicology results and following your consultations with the various medical consultants, were you able to ascertain and make a determination as to the manner of death regarding Michael Jackson?
Yes.
And what was the manner of death?
The manner was homicide.
And on what did you base your conclusion that the manner of death was homicide?
Well, there were several issues. Number one, circumstances, for example, Dr. Murray's statement to the police indicated that the propofol and other medications were administered by another person. Secondly, the propofol...
I'm sorry, that when you say by another person, you mean that Dr. Murray being the other person. When you refer to other person, you mean other than the decedent. Is that right?
Yes.
Okay, so you're commenting that Dr. Murray admitted to administering the benzodiazepines and the propofol.
That's correct.
Okay.
Secondly, there was not an appropriate medical indication. The problem that Mr. Jackson was having was that he couldn't sleep, and it's not appropriate to give propofol in that situation. The risk outweighs the benefit.
And did you also consider the setting in which this was taking place?
Yes, the setting was outside of a hospital or clinic. It was apparently in a home, and so there were a number of things that would ordinarily be used with propofol that were not available in this case. For example, there was not an EKG monitor. There was not a precision dosing device like an IV pump so that you know how much propofol the doctor is giving him. There was not equipment available to resuscitate Mr. Jackson adequately if he were to stop breathing. For example, there was not an endotracheal tube or medication that could be used to improve his circulatory function. And then finally, the circumstances, from my point of view, do not support self-administration of propofol.
And why is that?
Well, Dr. Murray tells us in his statement that he gave Mr. Jackson 25 milligrams of propofol, which is not a very large dose. And in order to keep him asleep, he had to give him additional propofol from time to time. He then went to the bathroom for 2 minutes, and when he returned from the bathroom, he found that Mr. Jackson was not breathing. So in order for Mr. Jackson to administer the propofol to himself, you would have to believe that he...
This is speculation. I'm going to overrule the objection under 801, 802, and 804.
Thank you.
Let me finish, please.
You would have to assume that Mr. Jackson woke up, although he was, at least to some extent, under the influence of propofol and other sedatives. He was able to somehow administer propofol to himself. The circulation time of the body passed. In other words, if you inject propofol in the leg, it takes a while for it to get to the brain. And then he stops breathing, and all of this takes place in the 2-minute period of time.
Okay. And that scenario does not support self-administration from your perspective. Is that accurate?
Yes, to me that scenario seems less reasonable.
Less reasonable than what?
Well, the alternate scenario would be, in order to keep Mr. Jackson asleep, the doctor has to give a little bit from time to time, which is, in this case, going to add up to about 2 or 3 tablespoons of propofol per hour. This is to keep him asleep. Now, we did not find any kind of precision dosing device, which means that essentially the doctor would be estimating how much propofol he was giving to come up with this 2 to 3 tablespoons per hour. And I think it would be easy under those circumstances for the doctor to estimate wrong and give too much propofol.
And some variation of that scenario you find to be more likely.
Yes.
Now, once you were in receipt of all the materials you've referred to, the toxicology findings as well as the consultations, your review of the defendant's interview transcript, as well as your evaluation of both the internal and external organs and components of Mr. Jackson, did you determine what the cause of death was as it related to Michael Jackson's death on June 25th, 2009?
Yes.
What was the cause of death, Dr. Rogers?
The cause was acute propofol intoxication, and the contributing condition was benzodiazepine effect.
And what do you mean by that? The contributing condition was a benzodiazepine effect. What does that mean?
There were two additional medications in Mr. Jackson's system, which were midazolam and lorazepam. Both of these are classed under benzodiazepines, and both are sedatives. So although the main thing was the propofol, there was a smaller contribution from these additional sedatives.
Okay, and would those additional sedatives work to exacerbate the effects that the propofol would have as far as respiratory and cardiovascular depression?
Yes.
So the combination of the sedatives as well as propofol could result in a quicker or enhanced depression of the respiratory system, causing someone to stop breathing, for example.
Yes, that's a possibility.
And the combination of the lorazepam and midazolam along with the propofol could also result in quicker or enhanced depression of the cardiovascular system and the heart, and cause the heart to stop essentially beating, correct?
Yes, that's possible.
And that is what you mean when you say the cause of death is acute propofol intoxication, and the contributing condition was the benzodiazepine effect.
That's correct.
Thank you. I have nothing further, Your Honor. Oh, I'm sorry. I did want to ask one additional question.
Sure.
Dr. Rogers, was a diagram prepared in this case? A diagram of Mr. Jackson and various observations that you made?
Yes.
I do have that diagram, Your Honor. I'd like to ask that be marked Peoples 207 for identification.
It's marked.
Dr. Rogers, showing you Peoples 207, does this note various IV puncture sites, either through resuscitative efforts or otherwise?
Yes.
Okay. And some of these are noted on the diagram. You note here at the top of Peoples 207, does that say endotracheal tube?
Yes.
Okay, and you have on the neck a puncture through resuscitative efforts. Is that accurate?
Yes.
And then you go through identifying certain puncture areas on the diagram of what would be Mr. Jackson's right arm,
That's correct.
as well as where I'm pointing here, as well as his left arm.
Yes.
And going down the diagram, you indicate a puncture mark just below, I guess, what would be the left knee. Was it your understanding that that was where Dr. Murray had administered the IV?
Yes.
Thank you, Doctor. Did you also, in your evaluation of this case following the cause of death determination, did you observe the empty 100 milliliter Propofol bottle, which has now been marked Peoples 30 for identification, but was LAPD item 106?
Yes.
And did you notice something unusual about the rubber stopper that you noted in your documentation in this autopsy?
Yes.
And what did you note unusual about the stopper? Again, I'm referring to Peoples 30, which was previously LAPD item 106.
The center of the rubber stopper has a more or less linear opening in it, so it did not show any needle punctures, but only this one opening.
And the linear opening in the rubber stopper that you observed, were you able to draw any conclusion as to what would have made that linear opening in that Propofol bottle?
This is the
Do you have familiarity in this area, based on your experience?
Yes.
Counsel can inquire further about that experience. Right now, I'm going to sustain the objection absent further foundation.
Thank you, Your Honor.
Thank you.
Let me first, if I could, mark the photographs, Your Honor. I have 3 separate photographs. May these of the top rubber stopper of LAPD item 106, Peoples 30. May these be marked? I believe it's 208, 209, and 210, respectively.
Yes. Marked.
Dr. Rogers, let me first show you, see if these appear, if these are discernible and with the overhead. Can you see to what you're referring on the Elmo, or would you like me to approach you with the photograph, Dr. Rogers?
Yes, it's present on the projection.
And do you have the pointer there with you?
Yes.
And what is the linear opening that you described as shown in Peoples 208?
In about the center of the stopper, there is an opening from side to side.
Okay, and it's basically a cut or an opening in the stopper going from where you pointed that circle demarcation on the rubber stopper. It's within that circle?
Yes.
All right, going next to Peoples 209 to see if this shows it from a different view. Again, can you point out in this picture, although it's a bit fuzzy from the Elmo, can you point out the opening that you've described?
The opening again passes from side to side within the rubber circle.
Okay, and you've indicated again with the pointer going from left to right within the rubber circle. And lastly, Peoples 210, again, slightly different angle. Does that again show the linear opening going from left to right or right to left within that rubber circle?
Yes.
Now, are you familiar with what a syringe needle, what type of marking that will leave on a rubber stopper such as this?
Yes.
Okay. Did you observe any syringe needle holes in this rubber stopper?
No.
And what is your familiarity, with identifying what could have made this linear opening in this Propofol bottle?
We're going to find out right now. Overruled.
I personally have used medical devices that could make such an opening, although I have not used them since medical school.
Okay, what type of medical device, in your opinion, would have made that linear opening on the 100 milliliter Propofol bottle?
The medical device is called a spike. So in order to get the propofol out of the bottle, you push a spike into the rubber stopper, and then the propofol will flow out the end.
Okay. Your Honor, I'm going to need to retrieve a couple exhibits. Is this a good time to break?
It probably is. Is this okay with the defense?
Yes, Judge.
Okay. Ladies and gentlemen, hopefully it's okay with you. We're going to take the noon luncheon recess at this time. Of course, please remember and follow to the letter all of the written admonishments as well as my continuing verbal admonishments. We'll be in recess till 1:30. Enjoy your lunch. Thank you.